Syphilis is a sexually transmitted infection, STI, caused by the bacterium Treponema pallidum. This infection has had a profound impact on human history, shaping medical practices, societal behaviors, and public health policies. Parallel to the history of syphilis is the development and use of condoms, which emerged as a crucial tool in the fight against STIs. This essay explores the history of syphilis and the emergence of condoms, highlighting their interconnected journeys and impacts on society. The origin and spread of syphilis. The origins of syphilis have been debated for centuries. One prominent theory is the Columbian theory, which posits that syphilis was brought to Europe by Christopher Columbus's crew after their return from the Americas in the late 15th century. This theory is supported by the timing of the first recorded epidemic in Europe, which occurred shortly after Columbus's return in 1493. The first major outbreak of syphilis in Europe was documented in Naples in 1495, during a French invasion. The disease spread rapidly among soldiers and civilians, earning various names such as the French disease, in Italy and Germany, the Italian disease, in France, and the Spanish disease, in the Netherlands. This widespread affliction caused significant suffering and fear, as medical knowledge and treatments were limited at the time. Early treatments and theories. During the early years of the syphilis epidemic, treatments were rudimentary and often harmful. Mercury was one of the first treatments used, despite its severe side effects, which included ulcers, tooth loss, and neurological damage. Another treatment involved the use of guaiacum, a resin obtained from the guaiac tree, which was believed to purify the blood. These treatments were largely ineffective and often exacerbated the suffering of patients. Theories about the cause and transmission of syphilis varied widely. Some believed it was a divine punishment for immoral behavior, while others thought it was caused by bad air or humoral imbalances. These misconceptions hindered effective treatment and prevention efforts. Advances in medical understanding. The 19th and early 20th centuries saw significant advances in the understanding and treatment of syphilis. In 1905, Fritz Schouten and Erich Hoffmann identified the causative agent of syphilis, Treponema pallidum. This discovery paved the way for more accurate diagnoses and the development of effective treatments. In 1909, Paul Ehrlich and his colleague Sahachiro Hata developed Salvarsan, Asfenamine, the first effective antimicrobial treatment for syphilis. Salvarsan marked a significant breakthrough in medical science, offering hope to millions of sufferers. However, it was not without drawbacks, as it required multiple painful injections and had toxic side effects. The true revolution in syphilis treatment came in the 1940s with the discovery and mass production of penicillin. Penicillin proved to be a highly effective cure for syphilis, with fewer side effects than previous treatments. This development dramatically reduced the prevalence and impact of syphilis in many parts of the world. The emergence and evolution of condoms. Condoms have been used for centuries as a means of contraception and protection against STIs. The earliest known condoms were made from animal intestines or bladders and date back to ancient civilizations such as Egypt, Greece, and Rome. These early condoms were primarily used to prevent pregnancy rather than disease transmission. The Renaissance and early modern period. The use of condoms for disease prevention became more prominent during the Renaissance and early modern period. In the 16th century, the Italian anatomist Gabriele Falloppio wrote about a linen sheath soaked in a chemical solution, which he claimed could protect against syphilis. This is considered one of the earliest documented uses of condoms for STI prevention. By the 18th century, condoms made from animal intestines or fish bladders were widely available in Europe. These condoms were often reusable and sold in apothecaries or through private vendors. Despite their availability, the use of condoms was not universally accepted, as they were often associated with promiscuity and moral decay. The 19th and early 20th centuries. The 19th century saw significant improvements in the design and manufacture of condoms. The development of rubber vulcanization by Charles Goodyear in 1839 revolutionized condom production. Rubber condoms were more durable, elastic, and affordable than their predecessors, making them more accessible to a broader population. Despite these advancements, condoms were still met with resistance from various social and religious groups. Many viewed them as a threat to traditional family values and moral standards. In the United States, the Comstock Laws of 1873 banned the distribution of obscene materials, including contraceptives, which hindered the promotion and availability of condoms. The role of condoms in public health. The 20th century marked a turning point in the acceptance and use of condoms, driven largely by public health campaigns and the recognition of their effectiveness in preventing STIs and unwanted pregnancies. The rise of syphilis and other STIs during World War I and World War II prompted military and public health authorities to promote condom use among soldiers and civilians. The development of latex condoms in the 1920s further improved their quality and accessibility. Latex condoms were thinner, stronger, and more comfortable than rubber condoms, leading to increased use and acceptance. The AIDS epidemic and condom promotion. The emergence of the AIDS epidemic in the 1980s underscored the critical importance of condoms in preventing the transmission of HIV and other STIs. Public health campaigns around the world began to emphasize the use of condoms as a key preventive measure. Organizations such as the World Health Organization, WHO, and the Centers for Disease Control and Prevention, CDC, played a crucial role in promoting condom use and dispelling myths and misconceptions. Advances in condom technology. In recent decades, advances in condom technology have further enhanced their effectiveness and user satisfaction. Innovations include ultra-thin condoms, textured condoms for increased pleasure, and condoms made from alternative materials such as polyurethane and polyisoprene for individuals with latex allergies. Additionally, the introduction of female condoms has provided more options for protection and empowerment, allowing women greater control over their sexual health. The impact of condoms on syphilis rates. The widespread use of condoms has had a significant impact on syphilis rates, particularly in countries with robust public health programs and access to affordable contraceptives. Condoms have been shown to reduce the risk of transmission of Treponema pallidum, the bacterium that causes syphilis, as well as other STIs. However, the impact of condoms on syphilis rates is influenced by various factors, including cultural attitudes, education, and access to healthcare. In some regions, syphilis rates remain high due to limited access to condoms, inadequate sexual health education, and social stigmas surrounding their use. Ongoing challenges and future directions. Despite the progress made in syphilis prevention and condom use, several challenges remain. These include: 1. Access and affordability. In many low and middle-income countries, access to affordable condoms and sexual health services is limited. Efforts to improve distribution and reduce costs are essential for effective STI prevention. 2. Education and awareness. Comprehensive sexual health education is crucial for promoting safe sexual practices and reducing the stigma associated with condom use. Public health campaigns must continue to target diverse populations and address cultural barriers. 3. Stigma and discrimination. Stigma and discrimination related to STIs and condom use can discourage individuals from seeking testing, treatment, and prevention methods. Reducing stigma through education and advocacy is vital for improving sexual health outcomes. 4. Innovation and research. Ongoing research and innovation in condom technology and STI prevention are necessary to address emerging challenges and improve the effectiveness of existing methods. The history of syphilis and the emergence of condoms are intertwined narratives that reflect the evolving understanding of sexual health and disease prevention. From the devastating syphilis epidemics of the past to the development of effective treatments and the promotion of condoms as a preventive measure, significant progress has been made. However, the fight against syphilis and other STIs continues, requiring ongoing efforts in education, access to healthcare, and the reduction of stigma. By addressing these challenges, we can work towards a future where syphilis and other STIs are effectively controlled and the sexual health of individuals is safeguarded.